Good prize, that one. Now, when you mention the words babies and sleep, you're guaranteed to get people talking.
Well, when Dr. Brian Symon spoke about his sleep techniques, he sure stirred up a hornet's nest. He joins us from Adelaide to set the record straight. Dr. Brian, you are known as the baby sleep doctor. You copped a fair bit of criticism recently for saying you should just put babies in bed and leave them there till the next day. Are you talking about controlled crying here? Clear it up for us.
The skill set that I have, the work that I try to do, David and Sonia, is to improve sleep for children and for families. If I see a child at birth or shortly after birth, what we are attempting to achieve is a 12-hour sleep by about 3 months. For those children that come to see us where they've got an established sleep problem, and these are very common in our culture, then I'm trying to achieve a full night's sleep, which is approximately 12 hours, and that we will achieve that within 2 or 3 or 4 nights for probably about 90% of the kids that we're looking after. Once the baby is asleep, the mother, the father are more than welcome to attend and check that the baby is warm and safe. The last thing that I'm attempting to do is to separate a mother from her child.
I guess the difficult thing, though, Dr. Brian, is that for parents, leaving your baby to cry can be excruciating, but you say picking them up can do more harm in the long run. So why is that?
Sonia, in our culture, crying has become quite a significant problem. At the moment in Australia, in the first 12 months of life, a mother will lose between 800 and up to 1,000 hours of sleep. The predominant cause for that is the child's distress. For children at the moment in Australia, average crying, it depends upon the resource you look at, but average daily crying is between 90 minutes and up to 2 or 3 hours a day. Now, the impact of prolonged crying is well known. That there is no debate about the fact that prolonged crying has negative impacts upon the child, on the family, on the relationship between the parents. There's a positive correlation between long-term crying and family breakdown, separation of the parents, child abuse, and their academic negatives for the child later in life. A large number of behavioural problems have been shown to be correlated with prolonged crying. Now, in work that we do, and remember that my aim is entirely to decrease the amount of distress and crying that parents experience and babies have to go through. In work that we published in the British Medical Journal in 2012, we showed that we were able to decrease the number of nighttime awakenings from approximately 5 per night down to 0.5, so less than 1 awakening per night.
That's really good. There'll be a lot of mums out there that would need that, Doc.
Well, we were able to decrease scores for depression by 85%, and that was with a single visit.
Well, that's because sleep deprivation really is a form of torture, particularly when it's to do with your child and you're anxiety-riddled with it as well. So you work with mums towards the end of their pregnancies to help them prepare for their babies. What advice are you giving them at that point?
So this is perhaps one of my favourite consults, is what I call it the staying out of trouble visit. And so at that visit we're looking at giving some basic knowledge, and there's a number of points of knowledge about how infants sleep, which we give at that time. And I emphasise the first week or 2 weeks of life where I'm looking to make sure the child is never left hungry, give them other strategies to avoid overtiredness, and to begin the gentle movement towards structure for the baby's 24-hour day, which we hope to achieve by about 3 months of age.
Fantastic. Dr. Brian Symon, thank you very, very much for your time this morning. And let me tell you, sir, with that voice of yours, you know what? You would be lulling babies just quietly to sleep.
Very soothing, Dr. Brian's voice.
Very soothing.
He nodded off halfway through the interview.
I mean, he's really good and great advice. So thanks, Doc. We'll speak to you again soon.
Coming up, what's